Assalamu alaikum, my dear student. In continuation, I am Dr. Salowa Sultana, Department of Pathology. Hope you did not get such a long vacation in your medical life. Very much popular story. How much time we have heard, did not know. What about the hare and the tortoise? If you become sleepy in this sleepy vacation, crisis vacation, we see slow one wins. Please remember this. Today, we'll discuss some remaining topic of neoplasia like Paraneoplastic Syndrome, grading and staging of tumor, tumor diagnosis. These are all about neoplasia with previous discussion. Along with this, some problem-based question which often make you problematic. We'll discuss today. Paraneoplastic syndrome. These are symptom complex occurring in a cancer-bearing patient, but cannot be explained on the basis of local spread, distal spread, or elaboration of hormone indigenous to the tissue from which the tumor arises. Often it may be the first manifestation of an occult neoplasm, or maybe a metastatic tumor, or maybe fetal condition. Four categories of paraneoplastic syndromes are endocrinopathies, neurological manifestation, musculocutaneous, and vascular with hematological disorders. Like Cushing syndrome, lung cancer, especially small cell carcinoma of lung, Cushing syndrome occur. Hypercalcemia due to parathyroid hormone related protein TGF alpha, vitamin D in case of lung cancer. Venous thrombosis occur in some tumors like pancreatic carcinoma, lung cancer, etc. Now grading and grading is done on the basis of cytological differentiation of a tumor cell and mitosis. Also histological pattern. Grade 1 when well differentiated or low grade, moderately differentiated or intermediate grade G2, G3 and G4, high grade. Grading differ in various types of cancer. Look, histology of breast cancer, grade 1, grade 2 and grade 3. Tubule formation, more mixed pattern and more in sheets. Also more mitosis. Staging done on the basis of tumor size, spread of regional lymph nodes, and metastasis. According to American Joint Committee for Cancer Research, TNM, T1, 2 and 3, 4 for size of tumor, number of lymph nodal involvement, presence or absence of metastasis. Clinical features of tumor. Sometimes there are a question, what are the features? There are general and systemic manifestation of a neoplasm. Why cachexia occur? You have to know what is cachexia, what are the local effect and other systemic effect. Also, there are variety of effect due to variety of tumor, like tumor of GIT related to decreased food intake, abnormal taste, also upper or lower GIT bleeding. Diagnosis of tumor. In short, firstly cytology like FNAC, pap smear, body fluid study. Histopathology, smaller biopsy to larger biopsy or resection of an organ. Tumor marker, immunohistochemistry, flow cytometry, genetic studies, molecular diagnosis like PCR, FISH, DNA microarray. All are nowadays used for diagnosis and also for therapeutic purpose. Now some scenario for you in Viva table or also in written. You have to answer a question related to the scenario of a patient. Case 1, female, 52 years, presenting with irregular PV bleeding. Her ultrasonography revealed normal endometrium. Think, what is your diagnosis? What should you do for confirmation? Where the lesion? Search myometrium, endometrium, cervix, ovary, fallopian tube, vagina, vulva. It is CS cervix, carcinoma of cervix. Histologically, squamous cell carcinoma is most common. For confirmation, we do bone biopsy, histopathology. For prevention, what should you do? Vaccination against HPV. Also screening test for say cervix, you know, pap smear, regular pap smear. Case 2, she is also a female, 52 years, also presenting with irregular PV bleeding, apparently held the cervix. In USG also on speculum examination. Your diagnosis. Think. As cervix is healthy, the lesion is endometrial lesion. It is endometrial hyperplasia, atypical hyperplasia, or endometrial carcinoma. Next, case 3. Male, 65 years, cough with hemoptysis for short duration, X-ray shows radiopaque shadow. Think. Carcinoma lung, most commonly squamous cell carcinoma. Related question: what are the techniques for diagnosis? We can do guided FNAC, CT guided FNAC, also lavage. Another case for you, case 4. Male, 56 years, non-healing, pigmented lesion over foot. Also, inguinal lymphadenopathy, yes or no? Think about this. What are the common lesions for histological examination? Bizarre looking cells producing dark brown pigment. So our diagnosis is malignant melanoma. What about the lymph node? Metastatic lymphadenopathy. So lymphadenopathy due to metastatic malignant melanoma from foot. Students, these are all for today's. Hope good health for you and your family also. Also pray for ours. Thank you all for patience hearing.